Good afternoon, Dr. Grill. It's nice to see you. Nice to see you again in person. I'm Dvora Entin. I'm an LCSW and a specialist in all things maternal mental health, really. And I work as a clinical consultant with Yesh, which is an organization that supports individuals and couples going through infertility, primary and secondary infertility. And this is one of our Tikva Talks, which means hope, which is something where we believe that the more education we can put out there, the more information we can provide out to the community around all things mental health, as well as kind of resources out there. The more informed we are, the better we are to handle whatever it is that we are struggling with. So I asked Dr. Grill, I heard her present last year at the Jefferson Infertility Conference, and was grateful to her to so quickly respond and say, yes, I'm happy to have a conversation. So Dr. Gill, if you could introduce yourself, and then you're going to give us kind of a lay of the land. We're going to be talking about sexual intimacy and its impact, the impact of infertility on sexual intimacy. And I'll ask you to kind of lay out the foundation for us, and then we'll have a conversation. So Dr. Gill, tell us all about who you are and all your amazingness.
Sure. Well, thank you so much for having me. I'm so glad that you asked, and I love that you're talking about hope, because it's such an important theme right now with everything going on with COVID and the world. I work at the Center for Reproductive Medicine, so I am in charge of, I'm Director of Psychological Services there. Been there for 20 years, which I can't believe. So I treat individuals and couples. I do a lot of group counseling, individual counseling, couples counseling, all around the whole reproductive journey and every aspect of that. So a big piece of what I talk about is sexual intimacy and how infertility and the infertility journey, as well as treatment, can really impact that. And I'm also the president-elect of STAR, which is the Society for Sex Therapy and Research. So it dovetails perfectly, the infertility piece, and then my specialty in sexual health and sexual dysfunction. And so I kind of put those two together, and that's one of the things that I just love to talk about, because it's often very difficult for people to talk about, and very important to have a platform for it. So I'm so glad that you are highlighting that platform today. So yeah, I'm just going to run through a few slides. I want to make it more conversational, but I just have a few things just to kind of guide us. I want to make sure I get the important stuff in. So first and foremost, the good news is that the majority of experiences that people have as they go through the infertility journey, as far as sexuality is concerned, any problems that come up are typically episodic and transient, meaning that they can pass with just some education and support. People can get through it. Normalizing it is really important, because I think what scares people most is that if no one's telling them it's normal, they start to feel like, oh my gosh, is this erectile dysfunction going to last forever? Is my desire ever going to come back? Is the closeness we used to feel ever going to be there again? And so I think it's important to understand that everyone is challenged as they go through this. Whatever your pre-function was is probably going to be what you're going to wind up with at the end. It's important to address these issues so that if you had some difficulties that you started out with and they become a little bit worse as you're navigating the infertility experience, you do kind of want to get some help and support so that it doesn't get worse. And like I keep saying, education is really the best way to have impact on this. This is really important in terms of the shift of meanings in sexuality. So all of a sudden, sex for pleasure becomes sex for procreation. And sex as an expression of intimacy becomes work sex. And sex as an expression of love becomes sex as an expression of failure. And so this association with failure, if you're trying each month and it's not working, or you're doing an IVF cycle, you know, women are being poked and prodded and put on hormones, and they're feeling bloated and they're not feeling like themselves. And so if all of a sudden the act of sex or sexuality is associated with pain and failure and discomfort, it becomes a pretty dangerous association. And here you can see those associations pretty clearly. We like to think of sexual feelings on the left-hand side of being kind of warm and affectionate, spontaneous, adventurous, tender, pleasure, full of emotional connection, hopefully fun. And when you look at some of the feelings that are associated with infertility on the right-hand side, you can see how these things do not mesh up and why this creates such a conflict. So suggestions for keeping sex enjoyable, and we can talk a little bit about how to do that during COVID, but devoting time to activities and interests that you enjoy together. So even going back and asking each other, like, what did we do when we first met? What did we used to enjoy doing together? Avoid kind of any ritualized, mechanistic, procreative approaches to sex. And if this is the way you always approach sex, this is a good time to try and maybe get outside of that and think of more creative ways that you can approach it. Sometimes people will even have sex for procreation in a different kind of area of the home than sex maybe as an expression of pleasure. Plan sexual activities that are playful, enjoyable, interesting, try sexual plays you did earlier in the relationship, flirt a little bit. But as I mentioned before, this is sort of, you have to figure out what your baseline was and where you're trying to get, right? So if your baseline was always, well, we always really focused on procreation, then there may be some different things you want to tweak to get through this experience. I think I'll stop there and see what interests you, kind of where you want to take the discussion.
Sure, absolutely. Do you want to stop share if that's okay?
Yeah, of course.
Get us big on the screen. Okay,
Yes.
perfect. You know, what I'm thinking about as I'm reading your slides, one of the things that's fascinating to me is I think especially within the Jewish world, particularly very often sexuality or sex in specific is something that's really introduced as a form of like, we get married, we have children, right? And I think one of the things that the people that I've talked to who are dealing with infertility is that deep disconnect between like, I'm failing at this piece of my life that is kind of what prompted me to get married in the first place, or has been such a dictate from the beginning. And so I think actually sexual intimacy has always been really deeply wound up with procreation,
Yes.
especially for a deeply religious or faith-based community. Maybe you can kind of tease that apart and how to give guidance to couples and how they can separate out the two, where maybe in a non-religious world, it is more about initially about fun than it is about procreation.
Yes,
but maybe it's
exactly.
a flip a little bit for those in our faith-based community. So can we talk about dividing out the two?
Yeah, we may not be able to divide them up, and that's fine too. You know, I think that each couple's different, and I want to allow for the space for everyone to feel, even in very observant religious communities, people that I've counseled, some people are a little bit more open-minded to exploring what it would be like to focus more on the emotional connection of sex, or learn how to focus on that. They're curious about it. While other people are exactly what you said, that it's very tied together. You know, it's considered a mitzvah, it's considered holy to be able to combine sexuality with the ability to reproduce.
Mm-hmm.
And so what do you do then when the ability to, you know, procreate seems to be stifled or may take a little bit longer, or more effort is needed, but it's so intertwined?
Right. I was thinking about it though, like there clearly is space within the religious framework for that concept, especially because we know that we don't stop being intimate once we hit menopause, right? We don't stop being intimate if we're on birth control. There definitely is space in the religious world, but I think sometimes perhaps young people can get maybe conflicted in that. Like if I can't have children, if I know that this isn't the month that I will be able to procreate, then what does sex feel like to me? And is there kind of conflict in that? So something to kind of tease apart.
I mean, there's definitely going to be conflict, and even more so than maybe other communities where it can be teased apart more readily, because the pressure that people are going to feel and the shame around that sense of failure is going to even be worse, right? Mm-hmm. For people where they know the whole community has sort of a watchful eye, like, oh, well, you just got married, and why aren't you pregnant with your first child yet? And that feeling of being even more isolated. And I say more because even in any community, that sense of failure is there and that sense of isolation is there, but definitely in communities where they're expected to start having children the second they get married, and they're being watched, sort of like, wait, you know, your friends are on child number 3 and you still haven't conceived child number 1, it can make them feel even worse about themselves.
Right.
So sometimes it's about controlling negative thoughts. I mean, there's sort of the practical piece about, well, what do we do if we're experiencing sexual dysfunction, right?
Right.
And then there's the emotional piece, like, well, you know, sexuality is okay. I'm associating it with failure more, and I'm not happy with my body right now, but we're able to still perform, right? Mm-hmm. So it's kind of two different issues. Mm-hmm. The emotional piece you can definitely combat with, how do I deal with negative thoughts? How do I balance negative thoughts in my head? Yes, I feel like a failure, but there's so many other ways that I am able to succeed, and I'm doing everything in my power to make this happen, right? Mm-hmm. Things that balance off the negativity. And in terms of the dysfunction piece, that's a real issue, you know, because if you are trying at home and all of a sudden your spouse is experiencing erectile dysfunction, or you're experiencing sexual pain, you know, when you're ovulating, these are issues that really help if you can talk them out with a therapist, because there's nothing worse than trying to engage in an activity that is supposed to be a blessing and it becomes very painful, you know.
So what I'm hearing you say is that there really is that when a person seeks support from a therapist or a specialist in this area, that we shouldn't make the assumption that, well, this is just what I have to go through in order to get pregnant. The pain, the sexual dysfunction component, or even the shame that comes along with that sexual dysfunction, like the erectile dysfunction, that there's such a commonality here. And there are techniques to help a person if this is something that they're dealing with. So kind of noting how important it is to get help and to ask those questions and to get guidance on something like that. When you talk about, go ahead.
I was going to say, not just to focus on the woman, like we're talking a lot about the sense of failure that a woman experiences, but men can feel a tremendous sense of failure and pressure to perform. And if they can't perform, whether it's they're unable to ejaculate or they're unable to maintain an erection, these are things that are just shameful and horrible for the man, and then impact, of course, the woman and the couple, and impact their ability to actually try on their own.
Right.
So there is help out there, and there are simple techniques that can help people with these problems.
Right. Yeah, I think it's so important that we're going to be doing another conversation around male factor as well as the men in the infertility process. And I think about what, the pressure to perform on command. The woman has to show up, but the man has to perform, and what that means for him to not be successful in that when there's this incredible time pressure. I always laugh and say, nothing's happening between a couple typically per night when he's drunk, right? Like if he's absolutely utterly exhausted and has traveled all day long, the physical exhaustion has an implication on body functioning. And I think sometimes women kind of will internalize a different message from that experience, this experience of like, maybe he doesn't really want to have a child. Why can't he? What are some of the other things that you hear women saying or kind of experiencing if there is erectile dysfunction or failure to perform? Or complicated
definitely there could be personalizing it, right? Like he's not attracted to me, or he doesn't want to have a child with me, or he's ambivalent about children, or he didn't really want to get married. But there can also be the anger and the rage that oftentimes isn't expressed because the woman's afraid to make the situation worse. But it can be this anger at, are you kidding me? Like, I'm doing my part, I'm here, I'm ready, I'm available to you, and now all you have to do is perform, and you can't. And that's based on a lot of myths too. There's this myth that men should always be ready, able, and willing to perform at the drop of a dime. It's not true. There's the same myths that women should sort of be available and receptive all the time. Also not true. So some of it is just breaking down the myths and the barriers with education. Let's not forget too that even with IVF treatment or IUI treatment, a man is also expected to produce a sample on demand. And that can be really difficult. And oftentimes women will say, are you kidding me? I have to take these injections every day and go for monitoring every morning. And all you have to do is go and produce a sample, and you can't even do that. So the man becomes even more ashamed of himself. Right. So these are very common dynamics in relationships.
Absolutely. And I was thinking also about kind of from a perspective of a couple who's trying to create a relationship and begins to, especially in an early marriage or an early relationship, where they come to an acknowledgement that there is a problem here in terms of fertility. Can you give me some ideas from your perspective that you've seen effective into kind of differentiating between physical intimacy and emotional intimacy? What are some of the things that you suggest to couples that are still trying to grow their marriage while also dealing and struggling with infertility?
It's really hard to do both at the same time, and often there's just no choice. So I don't think that a lot of women or men have the luxury of postponing because of either the pressure of having multiple children or the pressure of having gotten married a little bit later. The focus on their own biological clocks and the importance of how that affects the health of the child, right? And so oftentimes there isn't time to explore this sense of, they say the honeymoon phase, or let's just wait and enjoy the relationship. So sometimes you're doing both at the same time. I mean, the silver lining is that if you really commit to doing both at the same time, you can improve communication greatly. If you do the work, people come out on the other end closer as a couple and able to parent better.
Right.
Because they've been forced to manage this crisis so early on, oftentimes in their marriage. And so that forces them into this situation. Wow, we had to deal with sexual dysfunction, and we had to deal with IVF, and we had to deal with figuring out how to emotionally stay connected through all of that and communicate. And so if people really do the work, it can be amazing.
Mm-hmm. Yeah, I like that you talk about that, how we need to do the work no matter what, I think, because I've seen people who like push for I got to go next cycle, next cycle, next cycle. And I've noticed that the partner gets left behind, and the partner's kind of going, wait, 1 second. Like, how is this impacting you? How is this impacting us? How is this impacting our relationship? And the woman typically is one who's going, no, full steam ahead. I won't be happy. I won't be content until I am pregnant or until I have a live baby. And I find that's really hard for the spouse. And they wake up pregnant and they're like, and their husband's like, a year behind them.
Yeah, exactly. Right. And there's no right or wrong. It doesn't mean that either position is the right one.
Mm-hmm.
It just means that men and women are often on different pages. And it's really important to get back to the middle where people are compromising and meeting in the middle,
mm-hmm.
or at least acknowledging, hey, I know you're not on the same page with me, but thanks so much for coming along on this ride because it's more important to me right now,
Right.
So you don't want to build resentment.
Right. Any suggestions, kind of like your top 3 tips that you give people in terms of growing the emotional intimacy piece? Things about how making sure that couples are connecting independent of the physical?
I think date night's really important, even during COVID and even during sheltering in place, like finding time, even now more so, because people make more effort to spend quality time together when they're away from each other, when one or both people are out working and then coming back towards one another. There's that space to miss each other, come back, and then find the time. But when people are actually both at home, it actually makes it harder because you take each other for granted and you don't really. So date night's really important, even if it's like watching a television show together, reading a book together out loud, sharing a cup of tea, for 20 minutes, like whatever that looks like for each, couple is really, really important. Communication is really key, learning to be empathic, good listeners, knowing how to, they call it the paired listening technique. You can look that up, but it's basically learning to really take turns listening to each other so you're not reactive and being defensive. So that's often what causes breakdowns in communication. And then I think 3 is just understanding the gender differences, understanding that men and women absolutely experience infertility and its treatment very differently.
Mm-hmm.
And I think normalizing that from the get-go can help with a lot of arguments that wind up happening and a lot of emotional disconnect that wind up happening.
Mm-hmm. I appreciate that. I think it is important for us to bring up COVID specifically in the last couple of minutes that we have together, acknowledging, first of all, the deep complexity of people who have had to stop their infertility treatment. I know some of the clinics in New York actually stayed open, but I think we should note, by the way, Dr. Grill is actually out of New York. You said, oh, you the center, and you're like, but you didn't say you're part of Cornell.
Oh, yeah.
I'm like, she's like, that is that New York centric person over there, like, of course, the world revolves around Manhattan. So Dr. Grill is part of Cornell. But I think that concept of like a lot of facilities closed and treatment halted, and like all of a sudden they were faced with each other without a break, without time, and also without anything to focus on, or really even knowing when the future would kind of start up again for them. But from a sexual intimacy perspective, one of the things that I'm noticing is that there's definitely kind of a voice of people thinking like, well, this should be such a nice intimate time together, and that the challenges and the struggle of being in quarantine alone together without children has really increased a lot of the pain that I'm hearing from my couples, the couples who don't have children.
The research coming out of this COVID crisis is really showing that it is not necessarily bringing couples together.
No.
And that it's really a myth, because relationships do a little bit better with some distance. So when people are going out into the world and they have their own friendships that they're seeking out and seeing other people, or they have jobs that they go to and then they come back together, it allows more, to contribute to the relationship, and you're not on top of each other. When people are on top of each other, they don't have the distance. And they also, all the things that just sort of annoy you about your partner are highlighted. You just see them more. They're in your face more. So, another technique is really making sure to take time alone, have a little space that you get to go into a separate room or a separate corner of your apartment and just be able to say, I need some quiet time, or put some headphones on and be like, I'm going to listen to music. I need some. So that's good self-care, self-compassion.
I also think about it from a social perspective, how critical it is that women and men too, but I think the women value it in many ways stereotypically more. Don't forget your female relationships that fill you up. And if you need a Zoom meeting, if you need a physically distanced meeting on your front lawn, if you have one, or wherever you can sit, appropriately, and just spend time with friends, and not to forget the criticalness of those relationships. It creates some more vibrancy, I think, in the home relationship as well, in the marriage relationship too.
Absolutely. Absolutely. I tell people, do whatever you were doing before, just do it on Zoom. If you had a book club, if you had a coffee meet, if you, had a social gathering, a lot of the synagogues are still offering wonderful opportunities to do things online. A lot of the exercise programs are online. So there are lots of ways to still do everything that you enjoy doing, but doing it online. And that connection is really key.
Yeah, absolutely. And I guess we could conclude with, it's wonderful that things look like things are starting to open back up again. The clinics are opening. People are slowly beginning their cycling again. And don't forget the need for support. Like, it's so valuable when people reach out and get support and connect with other people who are going through it. When we minimize the isolation of this, we feel I think that's where people find the hope, is when they say, I don't have to do this by myself. I can do this with others by my side who can hold my hands. And so we absolutely, encourage you to reach out.
By Zoom. I mean, thank goodness it's one of the positions that can keep going very easily. And so there's plenty of support out there. There's plenty of support groups that are still being offered online.
Absolutely.
So don't hesitate to reach out.
Absolutely. And I would always suggest that making sure that the person that you work with is somebody who has some certification, has training, ideally from an ASRM or something similar, the American Society of Reproductive Medicine. A lot of people call themselves experts in infertility without having actually done any training. So I encourage you to seek an expert in your field, reach out to us. At Yesh Tikva, we have cohorts of support groups that are growing. We also have a men's infertility support group for the men in our lives that really should be seeking more support. Join us. Talk honestly among us. Dr. Gill, I really appreciate you being a part of our conversation today. And thank you I feel like I could talk to you for at least another hour, but I'm grateful for the time we had today.
I'm also going to offer a quick plug to some free apps that people can download, Ferticom and Fertistrong. For men and women. They're free of charge. And they have lots of different coping strategies and mindfulness recordings and lots of amazing tools.
Ferticom and Fertistrong. We will post that on Instagram we'll put it in the bio below. Okay, amazing. Thank you so much. And